America's top illustrator Norman Rockwell painted Doctor and Boy looking at thermometer in 1954. It shows a kindly doctor making a house call, which has become a compelling counterpoint to the healthcare that patients get today. A century ago, healthcare was delivered through individual practitioners, but that soon changed when group medical practices were formed. Today, doctors often seem rushed, spending little time with their patients and sometimes appearing insensitive to their needs. But it's not their fault. Doctors work within a health delivery system that has become much more complex. Despite remarkable technological advances, genetic studies, and automated medicine, not enough resources are being put into the care side of healthcare. What the system seems to forget is that it's not just the condition that is being treated, but the person. The inability to care for people shows that there is a great need for new models of healthcare. Welcome to CU Science Update. I'm your host, Ina Damm Muri. Many of us know a little about medical conditions. The challenge is to get doctors and patients to come together to sift through all the information so that patients understand where they are in their condition. In other words, a new model of healthcare, one that communicates to the patient, helping them understand what contributes to disease such as lifestyle, genetic predisposition, and one's environment will make it possible for patients to be able to research their conditions and become better informed. Then they'll have the experience of walking out of the doctor's office with an objective and some sense of control. A way to tackle these challenges is through the use of innovation, new ideas for doing things, some of which will come from outside the healthcare profession. Attaining greater insight into healthcare delivery, understanding the science that improves outcomes, safety, and increasing patient satisfaction are the goals of David Rosenman. He is a hospital-based internal medicine physician and assistant professor of medicine at the Mayo Clinic in Rochester, Minnesota. In 2010, Rosenman led a multimedia event called the Transform Symposium. Participants included a dynamic group of people from healthcare specialists to scientists, professors, bloggers, policy experts, anthropologists, and artists to discuss their ideas as part of a new collaboration, with the goal to transform how healthcare is delivered. Once a school teacher, Rosenman studied communications at the University of Pennsylvania, biology at Ball State University, medicine at Indiana University, and clinical research at the Mayo Clinic, where he was selected as one of their favorite teachers. He was a participant at CU's 63rd Annual Conference on World Affairs, and we are grateful that he made time to be with us in our studio, where he met with CU Science Update correspondent Priscilla Carlson.
I chose communication because in the place where I studied, it was the most multidisciplinary major that was available. And I kind of wanted to learn a little bit about everything. I was afraid to focus yet. And that's been a trend in my whole life. I like novelty and finding new things.
Okay. What do you do at Mayo Clinic?
I take care of people in the hospital. And I also teach in the medical school there and have been involved in some activities in Mayo Clinic Center for Innovation.
What do you mean by innovation? Can you expound a little bit on innovation at Mayo?
Yeah. So innovation means to me doing things in new ways for the better. And that spans industries and schools of thought. It can be in the world of technology and science, but as I see it, innovation takes place every day in all kinds of walks of life.
And how are you changing the way that people receive their health care?
Mayo Clinic has been known for a long time as a very special and trusted place for health care. I think originally that specialness came from the relationships among the people who worked there and in the way they approached care for patients. The principle that the needs of the person who's being cared for come first before anything else have guided everything at Mayo Clinic for more than a century. So that comes before science, and it comes before money, and it comes before the day-to-day process and operation. Everything is designed there to be sure that the needs of the people who come there for care are met. And I think that in concrete terms, that's manifest as really extraordinary human relationships at the bedside, in the hospital, and in the clinic, and even walking around trying to find a place to get a sandwich or a drink of water.
You have been known for bringing multiple disciplines together. and sort of like I said, the communications and the science. And how do you think that that changes the world of science?
It's arbitrary that science sits in a silo called science, and that art sits in a silo called art. We made those words to describe these things, these schools of thought that we also made. But in fact, it's how we communicate with one another and how we share information and what together we do with that information that really leads to anything that's meaningful. So I went into communication because it touches upon so many different walks of life. And also because communication is something that is not linear and generally not algorithmic. It's hard to predict from this moment to the next what I'm going to say, or what you're going to say, or what our needs are, or what our interactions are with the groups that we're in. There's a lot of unpredictability. If you've ever heard the distinction between a simple system and a complicated system and a complex system, I think that helps to make this point. A simple system might be like making a cake. You follow a recipe, and if you put the ingredients together in the proper order under the right conditions, you end up with a cake. And if you give that recipe to somebody else, and that person does the same thing, that person ends up hopefully with a cake, and it's probably about the same. A complicated system is very similar, but it involves a lot more math. So recently, human beings were able to build a spacecraft and send it to the sun, or close to the sun, and to make a movie of the surface of the sun, and to email that movie back to Earth, and then post the video on the web so that everyone around the world can look for the first time at a moving image of the surface of the sun in higher resolution than anybody's ever seen before. That's kind of mind-boggling to people today. And it could be done again if we wanted to, and we had the resources and need and interest, just by following that same complicated recipe. A complex system is very different. A complex system may also be, in some circumstances, simple, and in some circumstances, complicated. But complex systems are unpredictable. So, for example, raising a child is part of a complex system. What you do with one child doesn't necessarily end up giving you the same outcome if you approach another child the same way. In healthcare, we find that healthcare is both complicated, sometimes simple, sometimes complicated. We oftentimes feel the complication of healthcare, but it's also complex, and there's a lot of unpredictability. I thrive on that complexity. I really seek out that unpredictability, and I think there are a lot of people who do. You may have heard about the distinction between people who are left brain dominant thinkers and right brain dominant thinkers. The idea behind that lateralization is that people who are said to be left brain thinkers tend to prefer processes, linear procedures, algorithms, things that are fairly well organized and predictable, things that involve patterns. Those people who prefer the right hemisphere dominant way of thinking tend to prefer activities that involve spatial relationships, novelty, unpredictability, and finding relationships that didn't exist before or weren't obvious. We all use both of our hemispheres, but each of us tends to prefer one of those two ways of thinking for the most part. I think I'm a right dominant thinker. I think I prefer novelty and finding relationships across disciplines. And that might be why I like to link people from different schools of thought. And I think it's also why I went into science from communication. Why would I do that? Because you'd think that science is sort of the realm of a left brain dominant thinker, somebody who prefers linear procedures and algorithm and mathematics, right? And that's why I was a little scared of science to begin with, as I think a lot of right dominant thinkers are. However, it was novel to me, and if I could just get through it, I'd have this whole world of new languages and new concepts to play with, and even to be able to be an ambassador from one school of thought to another, and to find colleagues who wanted to do the same. And so in fact, although science is sometimes very routinized and chosen by people who are predominantly left-brain thinkers, I was thrilled at the idea of being able to explore that area as somebody who favors the right hemispheric activities.
So given that, do you think the future of medicine is like science and communications and other disciplines coming together? And how do you think that that will improve healthcare?
That's a good question. There's an idea that Daniel Pink has proposed. The author Daniel Pink has proposed that we as a civilization have moved from the agricultural period through an industrial age, through an information age, and now that we are in a conceptual age. And the information age is an age that was really ruled by knowledge workers, people who became experts in particular areas and then disseminators of that information, accountants, doctors, lawyers, scientists. In the conceptual age, he proposes, and I agree, that the future is really in the hands of the people who can transcend those silos and see opportunity in places that before were voids between otherwise separated silos. What that means for healthcare is that if a person needs some sort of help and biomedicine takes us only so far to be able to treat whatever condition that person has, we may find that there's healing potential in other areas that never were really part of medicine before. And some of those are starting to emerge now. We're starting to see that complementary and alternative and holistic medicine and Western medicine gradually are starting to merge, that each is starting to see the value in the other, and we're learning through our relationships and kind of developing a respect for what each profession does. We're able to provide care for people that meets not just their physiologic needs, but also all of the needs that span the biopsychosocial spectrum, including addressing issues that might come up in the family as a consequence of disease, including, for example, a much greater emphasis on prevention and the role that diet and movement and exercise play in our health, rather than what we have done over the last 100 years and more, which really has been to react to disease rather than anticipating it and preventing it.
What advice do you have for future scientists or maybe future people that are going into communications?
Right. So as we speak, the occasion of my visit to the campus here is the Conference on World Affairs. And it's my first time here, and it's an amazing event. And I love Boulder, I told you that. One of your extraordinary colleagues came up to me yesterday and introduced herself, and we were chatting. And we were talking about her plans after school and what she wanted to do with her future and the direction she might want to follow, or directions. And so she told me that she was studying accounting and that she hoped to go to graduate school in accounting, but she wasn't sure that's what she wanted to do. And what concerned her was that she didn't have a plan B. And having a plan B when you're a student is always really important, because you never know if you're going to pass the test or if you're going to get the major or if you're going to get into school. But what I shared with her, and what I share with a lot of people who express their stress that they're not on the path, whatever that path is that is societally accepted, or that educational or professional path that allows people to leave them alone because it sounds like they know what they're doing, is I invite them to try this exercise. Think of something in your life that has happened that you're grateful for. in your professional or educational life, for example, some professional position that you have, some great opportunity that came into your life, and ask yourself, how did that come to be? How did I end up in that situation? And when you have that answer, then ask yourself, how did that prior situation take place? What led me to that? Was it something that I just decided one day I was going to pursue? Did I have a calling for that? Or did it happen that I left my routine? That somehow I took advantage of an opportunity that I hadn't expected an hour before or a day before, or I ran into someone just by virtue of having made a chance decision to go to one place or to attend some event some day on some afternoon. Eventually, after only asking yourself that question, how did that come to be, a few times, you happen upon one of those unpredictable situations. And so tremendous good comes from giving yourself the liberty to have uncertainty in your life. People who have a plan A, a plan B, and a plan C are only guaranteed that they will follow plan A, plan B, or plan C. But I would argue that the majority of wonderfulness in life comes from not plan A, B, or C, but the other plans that just seem to surface because we allowed ourselves to bring those opportunities into our lives.
Cool, thank you. And one last question. Congratulations on Teacher of the Year 2011.
Oh, thank you.
That's really awesome.
Thanks.
What do you think it takes to be a great teacher?
That's a good question, because there are so many great teachers in so many subjects throughout history. And it's probably not just one thing, but I can tell you what's important to me. The opportunity to teach is an opportunity to have a mutually respectful relationship with somebody. I think without that, it's very hard for any learning to happen. And the relationship can be called a teacher-student relationship, but not very much teaching or learning occurs if there isn't a really good relationship based in mutual respect to begin with. Then I think a recognition that teaching is not one way. It's sharing. It's being able to share an admiration or an appreciation for whatever it is that's being taught and learned. So I suppose that's a long way of saying that I think the opportunity for great learning requires a mutually respectful relationship and a shared admiration for a topic.
It's no secret that the U.S. healthcare system is in need of an overhaul to provide better access and empower service providers and patients. A 2009 Deloitte consulting study shows that dollars being poured into healthcare are not translating into either great patient experiences or improved patient outcomes. Providers are paying for more procedures instead of less, and the study notes that consumers spend more time selecting cars than choosing physicians in hospitals, where outcomes and safety vary widely. New models for healthcare delivery have the potential not only to maximize quality, but also to reduce cost. In September 2011, David Rosenman will lead another Transform Symposium that will be hosted again by the Mayo Clinic. As before, the goal is to nurture dialogue and connect new ideas that have great potential for doing good and make meaningful change. We wish David the best success. That's all the time we have. We'd like to thank David for joining us today. More shows from CU's Conference on World Affairs to follow, so stay tuned. In the meantime, you can watch other CU Science Update episodes on iTunes or visit our website at cuscienceupdate.com. And don't forget to like us on our Facebook page, where you will find postings on latest science news. We'll see you next time!